So I would first of all like to welcome you all to our webinar this afternoon. Thank you very much for signing up and joining us this afternoon. My name is Natalie Merritt and I'm the Head of Knowledge Dissemination in Schools, and I work in the Schools Division at Anna Freud. So I'd like to warmly welcome you to our webinar this afternoon, which will provide a brief introduction to the topic of self-harm within education settings. With our expert panel, we'll look at the signs and causes and how to support the well-being of young people who are self-harming. We'll also think about supporting staff and colleagues within the school or college community who are directly working with these young people. So before we begin, I just wanted to give a quick trigger warning. Obviously, we know that the webinar is focused on self-harm, and there might be elements of the webinar this afternoon that could be upsetting or triggering, depending on potentially your own personal or professional experience of the topic. So please do feel free to look after your well-being. Please step away from your screen if you need to. And with this in mind, we'll also be recording the webinar, so you will have the opportunity to access it later at a time when you feel completely safe and comfortable to do so. So just touching on the aims of our webinar today, which is really introducing self-harm prevention in schools and colleges. So these are some of the things that we hope today will introduce you to. So first of all, we hope it will help you to understand what self-harm is and is not. Also to recognise some of the signs and causes of young people self-harming. We'll also be looking at a whole school or college approach to preventing self-harm. Also thinking about supporting not just the young people, but also the well-being of staff and colleagues who may be supporting these young people. And then lastly, we're glad to be able to welcome a young champion with us today, Emily, who'll be talking about their lived experience as well. So we will talk on all of these things and hopefully give you a bit of an overview of all of these. Then just before we get into the content of today, just a quick bit of housekeeping before we start. So for this afternoon's webinar, all attendee microphones and cameras are switched off. If you would like to submit a question to our speakers, please do pop this into the Q&A box, which you'll see at the bottom of your screen. Our support team will also be monitoring the Q&A, so if you have any technical questions, do let us know. We have closed captioning available during the webinar, and so you're able to enable or disable. You can also make the text smaller in the settings at the bottom of your screen if you would like to. And as mentioned, the webinar will be recorded and it will be shared on our Anna Freud YouTube channel in the next couple of weeks. And where we have permission from speakers, we will share the presentation slides with you. So before we get into the webinar, I just wanted to acknowledge it's obviously Children's Mental Health Week, which is a very significant week especially for us that work in the mental health sector. And the theme this year is Know Yourself, Grow Yourself. So I just wanted to mention that we have these monthly toolkits that come out every month from our Mentally Healthy Schools team. And we currently have one on the themes. We have one for primary, we have one for secondary and FE, and we always put these together. Monthly, they go out for free. They're emailed directly to your inbox. So if you would like to sign up to our Mentally Healthy Schools newsletter, I would highly recommend. It will be a variety of resources, so some for pupils, some aimed at staff, and they're always really practical, evidence-based resources that you can just pick up and use, and they're often related to awareness days and weeks of the particular month. So again, this week, Children's Mental Health Week, this is our February newsletter. Then just wanted to mention also, you can share any of your thoughts today with us on social media. So first of all, if you have any questions, you can always email us, schoolsinmind@annafreud.org. We'll be monitoring this inbox. And then on social media, our handle is @AFNCCF. And you can also hashtag schoolsinmind. So really, really pleased to now just provide an overview of the timetable today. We're going to be moving on very shortly to hear from my colleague Kaylee Lan. We will also be hearing from Emily, as mentioned, a young champion at Anna Freud. And then we'll have a presentation by Vicky Saywood, who's our head of training at Anna Freud. And then finally, we'll be ending with a Q&A. So again, please do put your questions in the Q&A box, and we will answer as many as we can before wrapping up this evening. So I'm going to kick off tonight's webinar with Kaylee Lan. I'm going to hand over to Kaylee in a second. Kaylee will be doing her presentation, which is around understanding self-harm, and she will also then be introducing Emily, our young champion, and they will be having a discussion based on her lived experience. So to introduce Kaylee, I'm really, really pleased to have Kaylee, who is a close colleague of mine, join us this evening. Kaylee is a highly skilled mental health professional with 17 years experience across both clinical and education settings. Her career began as a psychologist working clinically in the NHS, where she held several key positions, therapeutically supporting children, young people and families, as well as contributing to several large-scale international research projects. Kaylee later joined her local education authority as head of mental health, pioneering whole school mental health strategy that established a culture of trauma-informed and relational care across multiple education settings. Her strategic role included policy and strategy guidance, creating and delivering training, developing reflective supervision spaces for staff, and building a team of therapeutic practitioners to provide a tailored intervention programme to meet the mental health needs of students. Here at Anna Freud, Kaylee has worked across numerous high-impact initiatives, significantly influencing how schools across the UK approach mental health and wellbeing. She's contributed to the development of comprehensive toolkits, resources, and tailored training programs designed to help schools adopt holistic, whole-school mental health approaches. So I am delighted to hand over to Kaylee.
Thank you so much, Natalie. It's really great to be here with you and everybody else this evening. So I'm going to start us off just by taking us through some of the facts and figures around self-harm, just to give us a more thorough understanding. So the stigma around self-harm often prevents us having those open conversations, leaving many misconceptions unchallenged. And when we don't talk about it, myths persist, such as the idea that self-harm is just attention seeking, or that only certain types of individuals engage in it. When in reality, self-harm is a complex coping mechanism used by individuals across all backgrounds to manage overwhelming emotions. Silence reinforces shame, which makes it harder for young people to seek support. And as educators, creating a really calm, safe, non-judgmental space for these conversations is really key to breaking that cycle of stigma. Self-harm is not attention-seeking or manipulative. It's usually a really private, hidden behaviour, and many young people go to great lengths to hide it from others. Self-harm is not a mental illness. Rather, it may be linked to mental health challenges like anxiety or depression, but it's often a coping strategy used to deal with emotional pain. It's not just a young person's problem. While it's more commonly reported during adolescence, people of all ages can struggle with self-harm. Self-harm is not the same as a suicide attempt. While self-harm and suicide are connected and can be linked, self-harm is more often a way to manage emotions. Even though they're two distinctively defined mental health outcomes and share common risk factors, we will speak about those later on. So thinking about self-harm and how we define it, we use the NICE guidelines, so the National Institute for Clinical Excellence, which defines self-harm as any intentional act of causing harm to one's body, often as a way of coping with emotional distress, overwhelming feelings, or difficult life experiences. And self-harm can take many forms, including self-cutting, burning, scratching, hitting, or overdosing on medication, amongst others that you will see there on the screen. It's really important to recognise that some young people may not see their own behaviours as self-harm, meaning that their distress can go unnoticed and unsupported. So, for example, young males may express emotional pain through actions like punching walls or banging heads against walls, which might be perceived as aggressive behaviour rather than a form of self-injury. Similarly, young people engaging in risk-taking behaviours such as reckless drinking or dangerous stunts may not consciously identify those actions as self-harm, even though they serve a similar function of managing that emotional distress through dangerous actions. And because of this, self-harm in some groups, particularly boys or neurodivergent young people and those from marginalised backgrounds, may be under-detected. And this really reinforces the need for professionals to look beyond traditional self-harm behaviours and really consider whether certain actions may be expressions of emotional pain rather than purely behavioural difficulties. So what does the evidence tell us? So you will see here on the screen that we refer to probable mental health disorder. So let's be clear here what we mean by that. So NHS Digital, which is the data which we derive these statistics from, defines a probable mental disorder as a mental health condition that is likely present based on responses to a structured questionnaire. So a probable mental disorder does not mean a formal clinical diagnosis by a healthcare professional. Instead, it suggests that the individual has symptoms significant enough to indicate a high likelihood of a mental health condition, such as anxiety or depression. And in this particular survey data, children and young people were grouped into those categories based on their symptoms. So we can see here that 1 in 5 young people will have self-harmed by the age of 18, although many do not disclose it. Self-harm rates are rising in the UK, especially amongst young people, often linked to worsening mental health, and this may suggest that many are using self-harm as a way to cope with this distress. Among 11 to 16-year-olds with a probable mental disorder, 40% of girls and 24% of boys report having self-harmed at some point in their lives. We know that rates are increasing faster in girls than boys, but secrecy and differences in how self-harm presents across genders make exact figures uncertain. Research indicates that self-harm amongst males is still a significant concern, although it often remains underreported. However, we really can't ignore the worrying rise in self-harming rates in females, particularly those between the ages of 17 to 24. Shown here, 71% of that population with a probable mental health disorder have reported self-harming at some point in their lives. Now, the dataset response was too small to report on this figure for the males in that category. We know that there are certain societal risk factors that make a young person vulnerable to self-harm. So, for example, children with less than 80% school attendance has a 3 times higher risk of self-harming behaviours. And it's really important education staff know the risks associated with poor attendance far beyond the impacts on academic attainment. And finally, research consistently shows high rates of self-harm amongst LGBTQIA+ youth compared to their heterosexual and cisgender peers. Specifically, 85% of gender questioning young people and 61% of lesbian, gay or bisexual young people have self-harmed. And I'd really invite you to reflect on the reasons behind those shockingly increased figures. specifically when we consider the research showing the instrumental impact a sense of belonging to a community has on a young person's mental health outcomes. And it's really important to note that when we're interpreting this data, it's important to give the context behind it. It's difficult to say with any amount of certainty the rates of self-harm, because the facts and the figures that you see here are from self-report measures. And this relies on the young person surveyed, first of all, giving honest answers, but second of all, interpreting those questions in the exact same way. We know that many young people we've worked with have been reluctant to disclose their self-harm, and others may not even describe their self-injurious behaviours as self-harm. So the figures out there could potentially be much higher. Why do people self-harm? Self-harm is a coping strategy. It helps people to manage emotional hurt or stress. However, the reasons behind self-harm are different for each person and often very complex. And while self-harm may provide temporary relief, it does not address the root causes of distress, meaning that the underlying difficulties remain unresolved. Therefore, it's really crucial to explore and support young people in finding alternative, healthier coping strategies that help them process their emotions in a much more manageable way. Many individuals engage in self-harm as a means of regaining a sense of control over their emotions, or as a way to quickly alleviate intense distress. For others, self-harm may be linked to self-criticism, guilt, or a sense of needing to punish themselves. The motivations behind self-harm vary from person to person and can even change over time, which is really why it's essential to check in with individuals about their specific reasons. Each person's experience is unique, and what leads one person to self-harm may not necessarily cause the same level of distress in another. It's important to recognise also there's no hierarchy or measure of validity when it comes to reasons behind self-harm. Every young person's experience is significant, and understanding their personal motivations is a crucial step in offering meaningful support. What makes a young person vulnerable to self-harm? It's really important that we think holistically. So as educators, you all play a really crucial role in safeguarding young people's well-being. So taking a holistic view of that vulnerability to self-harm really considers the interplay between individual, family, school, and social influences. Young people's mental health often varies based on their own identities, but also what is going on in their environment and in their lives. We use the term risk factor to mean vulnerabilities or experiences that are linked to a greater risk of developing mental health problems. And young people don't experience these risk factors in isolation. Rather, they interact dynamically, shaping their emotional resilience and coping strategies. It's important to recognise that just because a young person has these risk factors, it doesn't necessarily mean that they're going to go on to develop mental ill health. Recognising the risk factors can help identify those students who may need extra support and enable the implementation of early intervention and prevention strategies. Now, we know from a really large research study conducted by our research team here at Anna Freud that there are certain risk and protective factors that can have a huge impact on a young person's mental health and either increase or decrease the likelihood of them using self-harm as a coping mechanism. So factors that help protect against these are known as protective factors, and they act as buffers against developing later mental health problems. Now, as education professionals, particularly if you're in a safeguarding or a pastoral role, it can be really difficult to work with young people who have multiple risk factors going on outside of the school gates. We can't always change what is happening at home for these young people. Yes, we can safeguard and mitigate risk as much as possible, but unfortunately we can't prevent family breakdowns or exposure to certain adversities. But what we can do is we can flood these young people with as many protective factors as we possibly can to tip the balance or those scales towards more positive outcomes. So think of it like a seesaw effect. The more protective factors a young person has access to, the less likely the risk factors will have a lasting impact on them. Having strong protective factors in life can act as a shield against mental health difficulties, and it won't always protect a young person from harm, but the more protective factors they have, the better chance they have of coping through difficult experiences. So some of the warning signs of a young person that may indicate they're self-harming: any noticeable change in their behaviour. Self-harm, whilst it's often a hidden behaviour, there are many different signs that may suggest a young person is struggling. You can see some of them summarised here on the screen. But really, as someone who knows that young person's best, staying curious and observant and noticing even the small changes in their demeanour can be really crucial in identifying when they need further support. So some strategies to support young people who self-harm. When we're thinking about self-harm, for many young people, it often becomes a repetitive cycle driven by overwhelming emotions and a lack of alternative coping strategies. And understanding the cycle of self-harm can help teachers recognise when a student may be struggling and provide that important early intervention. So really thinking about the trigger, any stress or pressures, but then the urge a young people feels, and then that follows through. It may provide a temporary relief, but then the aftermath may result in guilt, shame, and that cycle repeats itself again. Many young people don't see self-harm as a problem. They see it as a solution to distress. This is why punishment or judgment doesn't work. It just reinforces that shame and secrecy. So as teachers, as educators, what can we do? We can recognise the signs, create a safe environment, and encourage those alternative coping strategies. School staff are well placed to spot students who are self-harming and can intervene, but research tells us that staff often lack the knowledge and confidence to maybe address self-harm. Sometimes people are concerned that talking about self-harm will cause that young person further distress or even encourage the behaviour, when in fact that lack of acknowledging it may really further perpetuate that shame and secrecy. We know that those conversations aren't always easy, but as soon as a young person can be encouraged to talk about how they're feeling, the sooner it will be possible to provide the right support. Now, there are examples of some conversation starters around self-harm. But it's really important to not make the assumption that the young person wants to or is happy to talk about their self-harm. The person should always feel as though they have a choice. So really try to just create an open, safe space for a young person to really feel as though they can disclose to you what is troubling them. There are certain elements that our young people have told us that are really unhelpful. Be mindful about the language you're using when talking to a young person about self-harm or even suicide. Some language can be unhelpful and really make them withdraw for you. So consider rephrasing how you speak. Now we go through some of the real evidence-based strategies in more detail on our responding to a young person training course. We provide some really practical ways to manage self-harm based on research that can be suggested to your students. But for the purposes of today, I really like to give you some free resources created by our teams here at Anna Freud that can support you to really build a culture of healthy well-being, no matter what your position is in a school or college. And my colleagues will pop the links to this into the chat. This is what you see here are snippets from our classroom well-being toolkit, which is designed to give quick, practical tips to enhance and promote well-being in the classroom. We also have our anxiety animation and teacher toolkit, another great free resource we have available to download based upon cognitive behavioural therapy. This toolkit contains lesson plans, worksheets, PowerPoints, teacher guidance, and parent and carer guidance as well. So we really recommend you take some time to explore what's on offer on our website, with 99% of the resources being completely free and designed in-house by our experts in this field. And really, to summarise, school staff are not expected to be mental health experts, and we certainly don't expect you to be implementing any type of clinical intervention for self-harm. But what we do know from our research is that any mental health intervention will be much more effective in the context of a positive whole school approach to mental health and well-being, where there's a sense of belonging. Children and young people are explicitly taught good social and emotional skills and are able to identify feelings, thoughts, and emotions. And also, it's important to acknowledge that not all staff in your setting will feel comfortable having these conversations. It's really important that school staff have good quality training and ongoing support from the senior leadership team. Now, I am delighted to introduce our young champion, Emily, whose lived experience has been absolutely invaluable in shaping our self-harm trainings. Including the voices of our young people is essential to ensure our training is meaningful, relevant, and truly reflective of their experiences. Emily's insights, drawn from her own journey with self-harm and her education, have played a crucial role in helping us create this training that is both impactful and supportive. Emily is a final year undergraduate at the University of Cambridge, and her personal experience of compulsory education was unfortunately not a happy one due to the mental health challenges and the then undiagnosed neurodivergence. Having struggled throughout secondary school, she left further education without the qualifications to go on to further study. Emily spent some time working across hospitality and retail before taking a role as a teaching assistant in a specialist school for 2 years. This deepened her interest in the intersection between psychology and education. She then self-studied additional A-levels and was lucky enough to get a place to study education and psychology at the University of Cambridge as a mature student. And she's been involved with us here at Anna Freud since 2023, bringing together her lived experience and her academic interests to really contribute to mental health advocacy and understanding. Emily, it's really lovely to have you here with us today.
Lovely to be here, thank you.
No problem. I'm just going to collapse my slides down whilst we have a conversation about your experiences during your school years.
Mm-hmm.
So, Emily, how was mental health addressed in your school, and did this have an impact on your personal experience, either positively or negatively?
I think it definitely did. I think when I look back, I don't remember any real obvious input regarding mental health. I remember, circle time in primary school, but beyond that, in terms of like emotional literacy, there wasn't a lot of emphasis on it. I think if sort of personal development was discussed, it would more be in relation to creating resilience and getting on with things and achieving. so not sort of mental health more holistically. I think I knew that people existed who had mental illnesses, but I don't think I really understood that everyone had mental health, and that everyone experienced emotions, and you could experience it to like a normal degree, and you could cope with them well, or you could not. Um, and I think that definitely sort of affected the way in which I experienced my own difficulties. I didn't really understand what it meant. I knew that I felt bad, but like beyond that, I didn't really have many words to describe it. I think that yeah, there was sort of a pressure, an emphasis on academics, which of course makes sense, but I think that was definitely to the detriment of lots of people's mental health. I know that definitely made me more stressed, um, as opposed to motivating me. And in terms of sort of accessing help, um, I didn't really have very strong relationships with teachers. I would never have approached them. And I knew there was a school counsellor, but I would never have like tried to get into contact with them. I think it was quite conspicuous who was going to visit her, and yeah, it just felt um, yeah, it felt as if everyone would know. Whether or not that was the case, I don't know, but that was definitely a barrier.
Oh, thank you, Emily. Was there anything particularly helpful or unhelpful that school staff said or did when they were supporting you with your mental health, if you did reach out to anybody?
Yeah, so I think my experiences were largely unhelpful, probably in part because I was difficult to help and wasn't reaching out for that support. I think it felt very accusatory. I think first of all, my tutor asked me to go to his room at lunchtime. I spent all morning super anxious about what I'd done. Felt like I'd been given a court summons. Um, and then he didn't really quite know what to say. He was just like, "You're usually so, intelligent, like what's going on, like what's happening," sort of. It felt like I was in trouble. And I think that just made me completely shut down, even if I would have, potentially discussed anything with him. But I think that's maybe part of the wider picture of school not feeling very. I mean, you mentioned the sense of belonging earlier. Like, I definitely didn't have that there. Didn't feel as if I had those strong relationships with staff, and didn't necessarily feel like very safe to open up or share anything. So yeah, I think that was a part of it. I think if I had maybe like sort of key worker, like someone who I could speak to, or somewhere where I could have gone when I was distressed, that would have made things better for me.
Did you feel as though there was a stigma associated perhaps with struggling with your mental well-being?
Absolutely. I think I'm not quite sure where it came from, because looking back, I did have friends who did experience varying difficulties that I was aware of. But it didn't feel like something that could be discussed. It definitely felt quite shameful. There's, I think there was a little bit of a concern about being labeled as like a difficult or like problem child, whereas I like prided myself on being like a good student. Um, yeah, I think it probably came from lack of awareness, and yeah, just sort of lack of like belonging in the community as well, which meant that like you can show any vulnerability basically.
Thank you, Emily. Now, we know as part of safeguarding, schools have a duty to engage parents and carers around their child's mental health and well-being. How did school engage with your parents, and could that have been handled any differently?
Um, I think looking back, it could have been done a lot earlier. Again, I think that's probably because I did try my absolute best to hide everything from school staff, so not necessarily their fault. But I mean, I think I did everything I could to stop the communication. I mean, back then we still had like physical school reports and notes and things, so I would like destroy anything that would suggest that I was having any kind of difficulty that wouldn't get to my parents. Um, I had heard from friends that had spoken to a teacher about their own experience of self-harm, who had had really negative experiences where the teacher just, ran off to safeguarding, who made a phone call to their parents. And even if their parents were supportive, as I'm sure mine would have been, you don't want to upset them. It's quite distressing for a family to like not be involved, to not know like as the child like what's happened, what's going on. I think I felt worried it would start some huge chain of referral, which would end up with me like incarcerated in some like psychiatric hospital. Of course, not how it works, but I think if you have no experience, then you don't understand what's going to happen. Um, Yeah, I think eventually my mum got in touch with the school, but I felt completely out the loop, and that was sort of why I eventually left and refused to go back. So I think if the student can be given an element of choice in how things are discussed, maybe to be present if they're comfortable being there, then I think that would have been helpful.
Thank you so much. So I guess just to summarize, a main theme of what you're saying is you really didn't understand mental health at all. You didn't know where to go to for support, and it sounds like there wasn't much signposting available, and there was a real fear of things escalating if your parents found out. Would you have liked school to have explicitly taught you about mental health and in particular self-harm and really signpost you where to go for help and support?
Yeah, I think that would have been helpful. Like first, in terms of emotional literacy and just being able to recognize emotions, I think is really helpful in terms of learning like healthy coping mechanisms. Um, I think that especially for like neurodiverse young people, it can be quite difficult to understand how you're feeling, and sometimes that can come out in behavior. So maybe something specifically for young people who either have like identified needs or perhaps not, perhaps for everyone. Um, I think obviously you can't have a huge flow chart, but if I had some sort of understanding of the process of what might happen if a teacher spoke to my parents or if they referred me to the school counsellor, I think I would have felt a lot safer in speaking to someone. Um, and in terms of self-harm, it's a tricky one, but I do think that perhaps making young people aware of the sort of diverse forms of self-harm, because I don't think I really like knew until I was an adult that that's what I'd been doing. I hadn't been cutting myself, so I didn't sort of recognize it. So perhaps just greater recognition, which I don't think would necessarily encourage it. Anyway, that's just my opinion.
Thank you so much, Emily. Thank you for taking the time to be here with us today. We really, really appreciate all of your contributions to this project and the webinar today. And thank you so much, everybody. I'm going to hand over to Natalie again for the second part of today's webinar.
Thank you so much. Thank you, Kaylee. Yeah, your insights were so helpful. I think thinking about the context, thinking about the evidence behind, self-harm and some of the clinical presentations, really helpful. And thank you for facilitating the conversation with Emily. And Emily, just a huge thank you for just being so open and so brave with sharing your personal experiences. We at Anna Freud are very grateful to have you as a young champion sharing your experiences and also being a voice for other young people. So thank you so much. You're going to help lots and lots of young people. Okay, thank you. So we'll move on to Vicky. I'm really pleased to introduce Vicky Sayward, who is going to cover the next presentation for us. So bit of an introduction on my colleague Vicky. So Vicky is our head of training in the schools division. She has over 15 years experience working in education and mental health. She leads our school's training team in empowering education and health professionals to transform their communities. Her expertise guides the design and delivery of impactful training programs focused on whole school wellbeing, alongside a range of specialist mental health courses. Vicky's been instrumental in the success of government and privately funded initiatives, both locally and internationally, to improve children and young people's mental well-being. I'm very pleased to have you here, Vicky. So I'm going to hand over to you for our next presentation. Thank you.
Thank you ever so much, Natalie. Hello, everyone. It's lovely to be here. I'm just going to share my slides with you for a moment. And thank you ever so much, Emily, just to echo Kaylee and Natalie's thanks. That was really insightful. So, as I say, good afternoon, everyone. It's really lovely to be here with you today. And I'm Vicky. I'm following on from listening to Emily, and I'm going to explore with you self-harm prevention with you now from a whole school or college perspective. And forgive me if I refer to just schools or just colleges as we go through. Please do keep in mind I'm referring to all education settings. So you may or may not be familiar with guidance from for schools and colleges from Public Health England on the importance of having a whole school or college approach to mental health and wellbeing in each setting. This approach has been at the forefront of recommended good practice for more than 10 years now and has an incredibly robust evidence base to support its efficacy. Now, here at Anna Freud, we have taken the Public Health England 8 guiding principles that you can see on the left of the slide, and we developed the 5 steps framework, a slightly more streamlined version, including steps, as you can see, on leading change, working together, understanding need, promoting wellbeing, and supporting staff. Now, if this is new to you, we would recommend accessing our 5 steps framework on the Anna Freud website, and we'll make sure you have the link for that. It's a simple, free, interactive framework and has accompanying resources and examples to help schools and colleges create their own whole school approach to mental health and wellbeing. It is quality assured by teachers, school leaders and mental health experts, and will allow you to not only review, but maybe refresh your vision for a holistic approach for the whole school or college community. And there is in fact NICE guidance, that's the guidance from the National Institute for Health and Care Excellence on this for schools and colleges too. Just in 2022, so a couple of years ago, they published a systematic review of the literature covering whole school approaches to mental health and wellbeing. The resulting publication identified key principles and relevant scientific research to back up each recommendation for a whole school approach. So when we say whole school approach, we're talking about defining the entire education community as a single unit and involving coordinated action between curriculum, teaching and learning, school ethos and environment, and family and community partnerships. Now, the recommendations from the NICE guidelines on the social, emotional and mental wellbeing in primary and secondary education explains why a whole school approach is the recommended action. It also guides schools and colleges to ensure that there is a culture, ethos and practice that strengthens relational approaches and inclusion and that recognises the importance of psychological safety, to review the school's policies and procedures, and to practice and strengthen social, emotional and mental wellbeing positively and consistently, to review the school's accessibility plan, medical conditions policy and approach to understanding behaviour, taking into account neurodiversity and communication needs, and also to start to monitor and evaluate the impact and the effectiveness of the whole school approach that they're putting into place, all part of a school improvement or development strategy. So how does this help us to think about preventing self-harm for the students in our settings in schools and colleges? How can leading a whole school or college approach to mental health and wellbeing help? Well, Kaylee explained to us earlier that self-harm is when you hurt yourself to try to deal with distressing feelings. There could be a lot of different reasons for self-harm. Self-harm is not an illness in itself, but it is a sign of other difficulties that you could get help with. Now, our role within schools and colleges is to embed a whole school approach to mental health and wellbeing to provide a holistically supportive environment. This is your prevention strategy in education. Students are much more likely to be equipped with support networks and have positive coping strategies to manage difficult emotions, and so not to turn to self-harming as a way to deal with those difficult emotions. So can we have a whole school approach to self-harm? Maybe a question you're asking. Well, yes, because it's your whole school approach to mental health and well-being, and that's how school staff can really help. Other research has shown that there is a strong evidence base that school-based interventions aimed at reducing self-harming young people can be particularly effective because they can target multiple layers of protective factors. And schools are great environments to enhance young people's protective factors, like those that you're seeing on the slide. Protective factors, as Kaylee was telling us earlier, these are those attributes that help us to cope with adversity and to thrive, and they can act as a buffer to life's challenges and to keep us well. So harnessing good friendships, having trusted adults as a social support, and experiencing academic achievement, for example, all can reduce the risk of young people self-harming and them using that as their coping strategy. Schools can do a great job of providing opportunities to build on these. So what can schools and colleges do in practice to enhance these protective factors and to reduce the risk of self-harm? Well, we can educate our students, as we were just hearing from Emily. If we can teach our students to recognise signs of distress and healthy coping mechanisms, be really helpful. We want an atmosphere and a culture where we can talk about mental health openly and encourage help seeking and destigmatising behaviours. We also want to provide support for peers. It's really important that we ensure that we offer friends who are supporting a peer who is self-harming a reflective space to talk, and important that we signpost them to appropriate support or services if needed. Friends are a really important source of first-line support for young people who self-harm, but this can present an emotional toll and may increase the risk of friends self-harming themselves. But keep in mind, this is only in the context of other factors which may make them more vulnerable. Moving on to our whole school or college approach, as we've heard, if we are able to embed a relational whole school or college approach that promotes mental well-being and enhances relationships, which may reduce barriers to help seeking, this really focuses on the protective factors that the school environment can offer to promote positive well-being and signposting to other avenues of support. And lastly, it's really important that we address self-harm on an individual case-by-case basis, thinking about the factors underpinning each one. We must be mindful not to address cases together. Schools and colleges are arguably more important for self-harm support, given the low proportion of affected young people that we know actually seek external support via external health services. And furthermore, education staff are often the first to be aware of self-harm in individuals and are often a key trusted adult in a young person's life. Now, you've heard me mention the importance of adopting a relational approach a couple of times. Here at Anna Freud, we believe a relational approach is based on the belief that to thrive emotionally and mentally, we must have stable and fulfilling relationships. We know that relating to people in a caring and compassionate way without judgment and in a way that respects their rights, beliefs, and abilities is hugely beneficial. It may be helpful, for example, for schools to reflect on their behaviour policies. Behavioural approaches are not wrong, but used alone, they are unlikely to impact the behaviour of the students with the greatest need. Challenging behaviour is not always evidence of unmet need, but it can be. It's important to note that curiosity and context are key, as are relationships, which is reinforced as well within the NICE guidelines and an increasing evidence base on improving children and young people's mental health. And putting relationships at the heart of school life translates into supportive daily interactions, which can really improve children and young people's mental health. There are some other great side effects to this, which you can see on the slide on the arrow going up. At the same time, supportive interactions in schools and communities have found to decrease disruptive behaviours and mental health difficulties, as well as improving social skills and personal well-being. Studies show that showing empathy is the main component of supportive interactions. Teachers' empathy towards a withdrawn student, for example, has been associated with improvements in how positively the student thinks about themselves. And this is really important to keep in mind when we consider why a young person might be self-harming. Okay, I'm going to give an overview now of some different levels of support that schools can have in place to support students and ultimately reduce the risk of self-harm. So starting with some examples of universal support. I'm going to just talk about a couple of these that you can see on the screen. If we take having a robust mental health and wellbeing policy, for example, a whole school or college approach to mental health and wellbeing is best served by a separate mental health and wellbeing policy. Now, this document should explicitly bring together other policies that address mental health, such as safeguarding policies, anti-bullying or SEN policies, to really ensure that the approaches with them are aligned. A mental health and wellbeing policy should describe your school or college's approach to mental health and mental health concerns, increase understanding and awareness of mental health issues to better facilitate early intervention, alert staff to warning signs and risk factors, provide guidance to all staff on supporting students experiencing a mental health problem, and also provide support and guidance to students experiencing mental health problems themselves, as well as guidance or signposting for parents and carers. We've got some great examples within step 1 on our website, within our 5 steps framework, if you want to see how some different schools do this already. But an increasing number of schools are developing a discrete self-harm policy or including a specific section within their mental wellbeing policy on this. In our full-day training for school leaders that we offer here at Anna Freud on leading self-harm prevention, we really explore this and we can look at what that might appear like in your setting. Another example of a universal level is running wellbeing surveys for students. These are a great way to measure and monitor wellbeing and can provide insight over time of how a student's wellbeing may change. And it's an opportunity to put support in place earlier if a young person is struggling. Again, we've got some great examples for you to explore over on our website. That will be within step 3. So we go through the rest of these examples, as I mentioned, in much more detail in our training courses, but I hope that gives you an overview, and we'll make sure that you have the link to sign up for those in the chat. Moving up to some examples of targeted support for students who are self-harming or at increased risk of doing so. Schools may want to review the opportunities across the curriculum and the school day to include psychoeducation and signposting to support. This doesn't just mean in a one-off PSHE lesson or an RSE lesson, but across all subjects and all different times of the day as well. Given what we know about young people not accessing traditional health services if they are self-harming, ensuring that they know who they can talk to in school is absolutely vital, and signposting can support with this. To take another example, at this level of support, it may be suitable for schools to co-produce a safety plan for a student. Now, a safety plan is a personalised document designed to help individuals who self-harm or are at risk of doing so to manage these crises. No one member of staff should be developing such a plan in isolation. Work with colleagues, for example, designated safeguarding leads, and mental health professionals, if you have access to a school nurse, an emotional mental health practitioner, or a school counsellor to create the plan. Safety plans need to be grounded in each school's mental health and safeguarding policies and procedures. It would be beneficial to work together to plan a template, for example, in advance as part of your prevention strategy. And again, in our trainings, if you're interested, we do talk through this step by step so that you're able to build that up. Now, there are certain warning signs that a young person who self-harms is at an increased risk of serious harm. And so thinking about specialist support now, if as a school you're at the stage of requiring external specialist support, you will still need to be managing risk. This is complex. But to share an overview, to manage this risk, you'll need to be supporting the student to find out things like if they are self-harming more frequently or what method they are using. Staff will need to assess, for example, if the young person's self-harm has escalated to methods with a higher risk of accidental or unanticipated severe harm. So things like using a more dangerous implement to harm. So moving from a small blade to a large knife, or ingesting substances, All of these aspects will require thorough risk evaluation and management in line with policy and safeguarding procedures, and no member of school staff should be working in isolation to do this. And here are just a few pointers to summarise how school staff will need to be working while supporting students who are known to be self-harming or who are at increased risk of doing so. Balancing confidentiality within safeguarding responsibilities requires a careful, considered approach, but by being transparent with students, assessing risks thoroughly, involving parents and carers appropriately, and collaborating with external agencies all the time, keeping detailed records, which I know is bread and butter for many school staff, schools can ensure that they provide the best possible support while fulfilling their duty to protect their students. And to conclude this section, I want to touch a little more on the partnership schools are really well placed to hold with parents and carers. Generally, parents or carers should be informed if a student is self-harming, unless there is a compelling reason to believe that doing so would place the student at greater risk. Conversations with parents and carers about self-harm need to be approached sensitively, emphasising concern for the student's well-being and the need for a supportive response. It's a good idea to provide parents and carers with resources and guidance on how to support their child. You might want to offer to facilitate meetings with others involved in the student's care, like a school counsellor, nurse, or external mental health professional. There are resources with tips, scripts and conversations on this that we'll be adding to our Mentally Healthy Schools website soon, so watch this space. I'd like to move on to thinking about supporting staff. Schools and colleges have a duty of care towards their employees, which includes taking measures to safeguard and support staff's mental and physical health. With teachers and school staff increasingly discussing mental health issues, including self-harm with students, it's important that staff can talk to each other as well. Teaching these sensitive topics is vital, but it can also be draining, perhaps even triggering for adults as well. Without the right support structures, harm can be caused to staff without it being detected or understood, which is what we want to avoid. So having a student who self-harms can be incredibly distressing for a member of school staff, as I'm sure some of you on the call can relate to. Some staff may find it difficult to empathise with a student who self-harms because it is self-inflicted behaviour. They may feel scared and angry with them for what they have done. Now, these are understandable responses, but it's essential to remind ourselves working in schools that we are often the trusted adults to those children seeking more support. And so our response really does matter, as Kaylee was talking to us about earlier. In order to do this, staff need to make sure that they look after their own well-being. So being honest with yourself about your emotions, discussing your feelings with mentors, colleagues or line managers, and seeking support through formal or informal peer reflective spaces are really important ways to help school staff stay well themselves. It's important for school leaders to recognise that some staff members supporting students who are self-harming may have had or are currently having their own difficult experiences with self-harm or care for someone who does, and may not be able to manage or offer support to a student who self-harms at this time. This should be considered and discussed sensitively whilst working with other designated colleagues who may be better placed on this occasion to support young people with mental health difficulties, including those who are self-harming as a result. And I want to take a moment to reinforce that the feelings you may experience while supporting a young person who is self-harming will be completely valid. We all have mental health, and we all can imagine a continuum, like you can see on the slide, running from mental wellness to mental suffering. And if we think about, everyone will fall somewhere on that continuum at any given point. Where we fall can change over time or even throughout a day, depending on many factors. So understanding well-being as existing on this continuum for us all allows for a more holistic approach to promoting and maintaining emotional health. And we must understand that our well-being is not an all or nothing state, but rather a complex and dynamic process that requires ongoing attention and care. Working in a school and supporting students in this way does increase staff's risk of being impacted as a result of hearing about their students' experiences and perhaps witnessing the negative effects that it has on their lives. Secondary trauma, or vicarious trauma as it's also known, has also been described as compassion fatigue or even emotional burnout, which are terms that I'm sure many of you can relate to. There are some signs to look out for on this. So feelings can present very differently in different people, but may include feeling overwhelmed, feeling useless or unskilled, on edge, or maybe even numb and disconnected, or perhaps even an overwhelming sense of anger or despair may be experienced. This can present through experiencing mental pictures and intrusive thoughts, disrupted sleep, or changes in daily routines and energy levels. It's important to highlight that secondary trauma is a normal response to being exposed to supporting students who are self-harming. The impact can be cumulative, so be wary of the number of students a member of staff is supporting in this way, for example. And someone might be more susceptible at different periods in their lives to secondary trauma, especially depending on their own lived experience. Training provided to staff on mental health and wellbeing, including staff wellbeing, is an important protective factor. It's vital that staff know how and where to seek support if needed as part of a whole school ethos. Many schools, trusts, or local authorities do have support packages available for school staff. It's a good idea to look into this as a support system, so make sure that you're aware of what is available and how to access it. I also want to mention the excellent organisation of education support to you all, who anyone working in education can reach out to at any time. One area that we know can be hugely beneficial for staff supporting students experiencing mental ill health is having the opportunity to discuss it with someone else through supervision or reflective practice. Research evidence on supervision in schools is very much an emerging subject for study, despite its long history in the health sector. Over the past 2 years, however, evidence from 3 small-scale studies on supervision in school for SENCOs on this occasion and other professionals supporting vulnerable young people reported very positive findings from participants, and it's certainly something that we promote and can offer some training for you here at Anna Freud if you wanted to set this up in your setting. So in summary, school leaders and colleagues within schools are really well placed to create a culture and ethos in their settings to support everyone's mental health. Normalising conversations about self-harm within a culture of openness about mental health and psychological safety is an essential step for every school and college. There may be changes that are needed to be made, ranging from strategic, large-scale actions to smaller, more practical things that make a big difference to students experiencing mental ill health. So, change and improve school culture, create an open culture in your team that enables discussion about mental health. Get policies right, write and implement a policy that takes account of self-harm. And improve awareness and understanding. Let's educate staff and students on staying mentally well, including coping strategies, regulating emotions, and how we respond when challenges arise. Now, education support also have a great guide for school staff that's linked on the slides that you'll receive, including advice on what to do if you believe a colleague in school or college may be self-harming. So it's definitely one to take a look at for more information. Finally, signposting support for everyone, staff, students, and parents and carers alike, is an incredibly effective way of ensuring everyone knows where to turn if they are not feeling well. So like this poster for education support for staff, schools are really well placed to display information, both physically and digitally, so that if you work in a school, do reflect on where you see or share this information currently and what perhaps could be done to make it more accessible for everyone. If we can support one another earlier with distressing feelings, we can prevent the situation from escalating and decrease the risk of unhealthy coping strategies such as self-harm. Thank you for listening. I'm going to hand back to Natalie at this point.
Thank you so much, Vicky. That was brilliant. It was really, really helpful to have such a practical overview about the perspective of the whole school or college approach, and hopefully people came away with some holistic strategies that they can take forward as well. So thank you so much. I'm going to move on to the Q&A now and also invite Kaylee back. So we've had lots and lots of questions that have come through our Q&A this afternoon. Thank you to all attendees that are still here, still with us. We've got about another 20 minutes or so to get through the questions. So yeah, and thank you again to Emily. Thanks to all of our speakers this evening. So I am going to start off in the chat with, let's have a look. So I think one of the first questions we were asked, it was in regards to Kaylee's presentation, the stats from the NHS Digital, and someone had mentioned that perhaps it's not the lack of attendance that drives self-harm behaviours, but rather that those experiencing distress are less likely to attend school. I thought that was quite an interesting question, as obviously we know that there are really complex reasons as to why children and young people may not be attending. So just wondered if yeah, Vicky or Kaylee had any thoughts on this question or this point, I suppose, about the lack of attendance.
Thanks, Natalie.
Yeah.
Hopefully everybody can hear me. Apologies for the sound and the technical difficulties. But I have answered this in the chat. The research was really shared to highlight common risk factors in a young person's life rather than to suggest that non-attendance directly causes an increase in self-harm. So instead, we're really emphasising the vital role that schools play in providing those protective factors that support well-being. So as Vicky discussed through our whole school approach, it's the absence of those really important protective factors that we know can increase a young person's vulnerability to self-harm that may be indicating the research facts and figures that we presented to you at the beginning.
Thank you, Kaylee. Yeah, I think that's a really helpful explanation. I don't know if Vicky's got anything else to add.
Nothing further from me. Agree with what Kaylee said, and I think we just have to be wary sometimes with data. It's a really useful tool to have to demonstrate actually there are certain risks and certain groups of students who may be at increased risk of mental ill health, and it can be useful to demonstrate that. But we can't take that just in isolation. As you said, there are going to be a number of factors that are going to be contributing. And so what we can do from a school perspective is, really work collaboratively with the young person themselves, with their parents and carers, and with other key professionals to really look at what the key triggers are for that young person and decide what support can be put in place that's best going to help them at that time.
Excellent. Thank you both. This was a very interesting question. So someone asked, could people's reasons for self-harm change on a daily or weekly basis, perhaps, depending on the events that happen in their life?
Absolutely. So coping strategy, self-harm is a coping strategy to cope with whatever distressing emotion that young person is feeling at that particular time. As we saw with the cycle of self-harm, it can become a real repetitive, ingrained pattern of coping style, no matter what that young person is feeling or where that distress is coming from. So yeah, it is absolutely viable that those reasons could change just depending on what has happened.
Thank you, Kaylee. Vicky?
No, do you know, I was thinking whilst Kaylee was speaking with Erin's question that when we all have different coping strategies for sort of life stresses, whether we're realizing it or not. And, you know, the reason I might, not to trivialize it, but the reason I might go for a glass of wine after a long day at work could be part of my coping strategy to sort of decompress after the day. And you know, that can vary on a day-to-day basis. And I think it's, as Kaylee was saying, once you're in that cycle of embedded behaviour and it becomes habitual, then that's where we have some of the challenge of breaking that cycle. So if we're able to sort of intervene as early as possible to build healthier coping strategies, then that really is what we're trying to do here.
Thank you very much. We also had quite a few questions that came in around the age of young people that may self-harm or may be at risk. So we had several questions saying that, yeah, they may work with 5, 6, 7-year-olds. What should they do in the situation with a very young student? Is that perhaps a slightly different strategy? Also, I guess, how young could we start having those conversations with young people around self-harm?
I think this is a really difficult one to answer because obviously each case is different. The reason why we say that our training is aimed at secondary school, but also acknowledging, you know, maybe late primary school students as well may need some of these strategies, is that the reasons for self-harm in younger children can often be really complex and can be linked to either undiagnosed neurodevelopmental conditions or really adverse early life trauma. So we would always recommend consulting with a specialist where self-harm is present in younger children. Aside from that, there are things obviously that we would recommend in terms of advocating for healthy coping strategies for primary school age children. Always kind of introducing those emotional literacy programs to understand their feelings, their emotions. You know, there's lots of different programs out there for that social and emotional literacy. So we'd absolutely advocate for that. But where you're seeing those self-harming behaviours, it is absolutely warranted to refer for specialist advice.
Just make sure that any emotional literacy programs or anything that you bring in for those younger years as well as older has a robust evidence base. There's some brilliant marketing that goes on to schools. There's not always the research to back those up, so just check those out and be aware before starting anything new in your setting.
Thank you both, that's very helpful. We have had a couple of questions around if there's anything specific for SEND students or students that might have neurodiversity. So I don't know if there's anything from your perspectives that would need to be considered with those students. Kaylee?
The reasons, well, I'll address neurodivergent students particularly. The reasons for self-harm for that particular cohort of students can be different than neurotypical peers. And when we're really thinking about, you know, maybe sensory differences or trying to really fit into an environment that was built for neurotypical peers, for example. So some of the environmental considerations and adjustments can be quite specific. We do address this in our training programs in a little bit more depth. A lot of the strategies that we suggest could be maybe tweaked and used in different ways and adapted in different ways for SEND students and also for neurodivergent students. But ultimately, it's really thinking about the individual young person and what is driving their distress, particularly from an environmental factor, taking that experience sensitive approach and really thinking what is their experience of the world around them, how are they perceived, how are they understood, where is the source of their distress coming from, can I make any reasonable adjustments to dial down that distress. It's always based on the individual child or young person and really emphasising and focusing on their experience.
Thank you, Kaylee. Okay, I'm going to move on to, we've got quite a few questions around language, which I thought was quite interesting. So a couple of people have mentioned kind of using the right language. So one example is, obviously the language is always changing. So for example, should we be using the words challenging instead of difficult? Should we be using words instead of adverse rather than issue? So it would be good to just hear a bit around language and kind of getting it right or wrong. And is there a right and wrong?
If I start off with this one, it's a really interesting question. Language is always evolving, as you've rightly said, and I think what's perhaps more important is that as a school or education setting community is that you have had this conversation ideally together. So talk to students, talk to parents, talk to staff, talk to any other sort of members of the community that are working with the school. Because if you can have a consistent language to talk about all things mental health and well-being, it makes having the conversations a lot easier, a lot more open. And that's not to say that that doesn't change with time as well. It could be, we know many schools that started off referring to emotional well-being, for example, with their policies and procedures and whole teams, we're going to go and speak to the emotional well-being team. And they have then changed that over time. Some have gone, so actually, no, we want to call this mental health. That's exactly what it is. Others prefer to use well-being. It's a really subjective thing, but what's more important perhaps is the understanding behind it. So making this a collaborative process to discuss language, we would say, is the key thing. If you decide to use adverse or problem versus issue or whatever, that's okay. And I think it's really important to share with everyone in the community that we have an ethos and a culture that we can talk about this. And if somebody says or uses language that is offensive or upsetting to someone, then it's okay to say, well, actually, I would prefer it if we said that, or could you please use that instead? Because there's not always going to be a one size fits all here.
Yeah, I agree with that, Vicky, absolutely. I think there's a real fine balance between, there's a danger that if we're too worried about the language that we use, then that perpetuates the stigma and the fear of not saying anything at all. I think the language we use around self-harm is incredibly important in shaping how young people feel about their experience and whether they feel able to seek support. And above all, using non-judgmental, validating, and really person-centered language just to encourage those open conversations is key.
Thank you, Bo. We are trying our best to get through these as we've got so many questions. So we've had a few comments around roles in schools. So I was maybe going to address this to Vicky in the first instance, but we've had a few comments from ELSAs who have said, they may have witnessed self-harm in schools. However, they're not sure if they should approach it or not. Maybe they're not the right person. Do you have any advice for people working in maybe that sort of role in a school? Are they the right people? Who else should they speak to if they have concerns about young people?
An excellent question. And I'd say, first of all, brilliant that this is on your radar and that you are hopefully not thinking about this in isolation. So absolutely do speak to colleagues within your team. You may have another colleague that has a similar role to you, and you hopefully have an opportunity to speak to a line manager or somebody in a position with a safeguarding knowledge. Perhaps they are a designated safeguarding lead within your setting. Definitely have that conversation if you're seeing anything that would raise concern, and do that in line with your normal safeguarding procedures. I think whether it's right to comment or not on it is really going to depend on your confidence and understanding, and perhaps going back to that question we just had around language as well. But also your relationship with the student, with that child or young person. What's important is that they are able to come to you and you have that trusting relationship where you're able to be open and honest with one another. And that sometimes can take time to build up. So you might not necessarily have that in the first instant, but for a child or a young person to feel that sense of trust and that they belong within their school setting is going to mean that they're more likely to be much more open. So it's okay to ask. It's okay to question and mark, or to just talk more generally and ask, how someone's been feeling, and to help support them to do that, because it could be that they're not able to verbalise that as easily. But absolutely, not in isolation. Speak to colleagues, speak to designated safeguarding leads within your setting. And if you have access to a reflective space or other colleagues that provide a sort of supervision opportunity for you, then that absolutely would be a great place to discuss it further.
Thank you, Vicky. We've had a few questions around the role of parents and carers in this. Obviously, really crucial to involve parents and carers, but we've had questions around, if the young person has told school staff they don't want their parents or carers to know, how should school staff address this? Someone mentioned guilt competence, for example. Is there anything you would recommend around when to involve parents and carers and how that should be done sensitively? Kaylee?
I think, again, Natalie, without kind of dismissing this, it's really difficult to say, because obviously there are safeguarding procedures that you have to follow, and involving the DSL, the designated safeguarding lead, is absolutely essential in making these types of decisions, because they will have protocols that they follow, and it all stems down to the amount of risk involved. So if the DSL would weigh up that the risk to that young person from telling their parents or carers is much higher than the self-harm itself, then that decision is made on the basis of that. So we can't comment on whether that's the right or wrong thing to do, because each individual child should be risk assessed by people who are in the right position to do so in the school or college environment. In terms of the conversations with parents and carers and how to involve parents and carers effectively, this is something that we worked really closely on with our young champions. It was very much felt that conversations with parents and carers could have a huge either positive or negative effect on the outcomes for that young person, if those conversations are handled really sensitively and with agency for the young person. So they perhaps had a say in how or where their parent was told, having consideration of, maybe that parent is in a really important meeting in work and the young person asks, I would prefer it if maybe we could wait until my mum is out of work so she's not so stressed. Could we tell her together after school, or something like that? It would all have to boil down again to the risk, how much risk is involved at that particular point in time, but then also really taking on board that young person and their views and giving them a sense of agency and control in those conversations, acknowledging that they can also be really difficult for that parent or carer to hear. And you as a member of school staff can almost act as that bridge between the young person and their parents and carer, helping to support both sides of that conversation and facilitate that safe shared space between the parent and child.
Thank you, Kaylee. Vicky, did you have anything to add?
Just to say, from personal experience in school, having some of those really difficult conversations, as Kelly's just described, it was really common to, to really see shock, disappointment, sadness, guilt, fear, all of these emotions when having a conversation about self-harm with parents and carers. And actually, as Kelly was saying, just holding that space, giving time somewhere that, ideally face to face, and as Kelly was saying, at a time that is going to be perhaps less of a shock, and someone can really react in a sort of natural way without worrying where they are, and being safe about how they're reacting and where they are is really important. You're not expected, if you are the sort of the mediator in that role, you're not expected to have all the answers. You're not expected to solve everything. And indeed, you won't in that, that very first meeting, but actually creating that place of trust and safety as a starting point is really, really key, and it's going to be key in that young person's recovery as well.
Thank you so much, both. I'm going to try and do 2 more questions. So first question, someone had asked, do you consider, I thought it was quite interesting, disordered eating to be a form of self-harm?
So again, we can't comment on such an individual case, but what I will say is disordered eating has the potential to really rapidly deteriorate into a severe mental illness, and it's really important that schools seek specialist input and support for that young person as soon as possible.
Thank you, Kaylee. I also wanted to just mention there was lots and lots of questions around resources, things we can share, signposting links. So I just wanted to confirm to everyone that we will be sharing a list of different places, different signposting, organisations and trusted evidence-based resources, as well as the slides. So you will receive all of those. And just finally, before we wrap up, then a few questions around self-care for staff. And, one of the questions was around what do you do if you don't have access to a counsellor in your setting? Are there places that you would recommend for staff who work in these sorts of settings to turn to for advice? And basically just the best ways to look after themselves. Any final recommendations before we wrap up?
I'm very happy to give a couple, and Kaylee, please do add in from your perspective as well. I guess there's the external sort of support that is available. So we cannot recommend education support enough. They have helplines, but they also have amazing resources on their website and chat to support anyone in any role working within education. They have a real variety of experience and supports, not just school-based concerns. It could be something that's happening to you personally, it could be something financial. So as an external supports provider, do look into them. I think it comes back to having the conversations, so speaking to your colleagues, speaking to leaders within the setting, and please do feel free to quote us. Say I've attended a webinar from Anna Freud. They're talking about the opportunities, how important it is to have reflective spaces. Do we have access to that? Because quite often colleagues do not know. When I was teaching, I didn't know that my local authority, for example, offered, I believe it's 6 free counselling sessions for all staff. And many trusts have employee assistance packages now as well, and they're just not always thoroughly communicated. So if you're able to ask the question. And finally, in terms of that self-care, as I was saying earlier, we need staff, we need the adults around children to be mentally well in order to really support those children and young people, particularly the ones we're talking about here who are self-harming or at risk of doing so. So knowing your limits, knowing your boundaries is really important, but also keeping your metaphorical cup topped up by doing things that keep you well. So, really taking a moment and thinking, what helps me when I'm stressed? What keeps me healthy day to day, physically and mentally? What's good for me? Because all of those things keep you topped up so that when the challenges and the stress comes along, which it unfortunately will, working in a school especially, then you're in the best sort of physical and mental place possible to respond.
Thank you so much, Vicky. I think that is all we have time for this evening. So I'm going to wrap up by saying a huge thank you to our speakers. Thank you to our amazing panel. Thank you, Vicky. Thank you, Kaylee. Thank you, Emily, for such insightful experiences, professional and personal. We've really appreciated your time. Thank you to all the attendees this evening. It's been incredible to see so many of you. I think we had almost 1,000 delegates online this evening. We will, as we said, share the slides with you, share links to resources and signposting, and we will also be sending you to a feedback form. It's in the chat as well. We would be really grateful if you could take a couple of minutes just to give us your feedback on the webinar webinar and help us to continue improving and ensuring that they respond to the needs of you. And we will be back with another webinar in the summer term, so also look out for that. Thank you so much, everyone. Take care, look after yourselves, and have a lovely evening. Thank you.